Okay, hello, I'm Dr. Brightman. I'm going to talk a little bit about crisis counseling, one of my favorite classes. I'm going to talk a little bit about suicide prevention. And that is chapter 8 of the crisis counseling textbook. Um, they call it a crisis of lethality because suicidal people are often homicidal. And I guess they figure they've got nothing to lose, so if I'm going to go, I'm going to take somebody with me. Now, let me talk about some statistics, though. And this is focusing only on suicide again, not homicide. But in the U.S., there are approximately 30 to 35,000 suicides every year. And that equals about 85 per day. So it's a big problem. It's not just not occasionally happening. Worldwide, it's about 1 million a year people that take their own lives. That's tremendous. Let me see. I've got some more statistics for you. Um, about 300 to 600,000 people in the United States survive a suicide attempt. And that may be what they're doing is they're crying for help or they're crying for attention. They're like, hey, look at me, come talk to me. But a lot of them, even though they're only trying to cry for help, they wind up killing themselves. And it turns out that it's about 10th or 11th cause of death in the United States every year. It varies between the 10th and 11th. And men are usually more likely than women to commit suicide. However, nobody is 100% suicidal. Many people who are thinking about it can be talked out of it. People with a death wish are often they're ambivalent, confused, and grasping for life. So basically, they're people that are ripe for intervention, someone who needs to talk to. And although it's been in the news a lot lately, you might have seen it, it's important to remember that assisted suicide is not the same thing as euthanasia. You're helping someone kill themselves or you're actually murdering them. So assisted means you're just providing the means, I guess that's why there's a gray area there. But suicide is thought to be the least forgivable of all deaths with little sympathy. People take their own life. They did this to themselves. It's not like, they deserve my sympathy. It comes after murder, of course, someone killing you, and even after neglecting your own health. People, might not care too much about taking care of their well-being, but they don't want to die right away. So that's why it's thought not nearly as bad as suicide. You're like ending it right now. And there are some characteristics of people who commit suicide. The book says that there are 6 types. There are situational people. They have an unendurable psychological pain and they're frustrated psychological needs. There are often motivational people. They're just, trying to find a way out. They're seeking for a solution to their problems. There are people they have, affective, they commit suicide affectively, means they're hopeless and helpless. There's people who they cognitively think about it and they're ambivalent. They have no way out. They have very few options. It seems like this is the only thing that will help them. There are some people who are relational. They believe that this is the you know they want to communicate that they are in charge, and then they decide how they take their way out. That's the main thing here, is that people who are relational believe that they're in charge of their own life and they can end it if they want to. There are also people, their lifelong pattern, they just have never been able to handle problems, and this is just a way, another way to solve their problems. It's been a lifelong problem pattern. But as I said, suicidal people are often homicidal, so you got to watch out. They'll take people with them. People in Colorado who killed all those people in their school, they were suicidal. They wanted to end their life, and they took a lot of people with them. They feel, a lot of researchers feel like there's a thin line between murder and suicide. As I said, suicidal people feel like there's nothing to lose, so might as well. Now I'm going to talk about some of the myths. There are many. There are about 20 that the book lists. Oftentimes, helping professionals are afraid that if they discuss suicide, that it will cause a client to move towards that. If we talk about it, he's going to get that idea and do that. That's a myth, though. That rarely happens. Talking about it is usually a good thing. Another myth is that clients who threaten suicide don't do it. Well, I wish that were the case, but most people who threaten it usually follow through with that threat. Suicide is an irrational act. That's another myth. You may think so, but, people have thought this out and they've thought it through. Another myth is people who commit suicide are insane. That's not true. In fact, many people who commit suicide are very intelligent people. They've thought this out, and this is the way they've decided. Another myth is that suicide runs in families. It is inherited. We all know that's not true. Another myth is that once a person is suicidal, they're always going to be that way, whether you help them or not. But if you provide them with the right help, that doesn't always have to be the case. When a person has attempted suicide and pulls out of it, the danger is, really over. Well, that's a myth. I mean, people try again and again. If they're looking for attention, they may do it again. Especially if they got attention when they tried it the first time, and they got a lot of help. That may be a perfect reason to try it again. And this time, unfortunately, they might actually succeed and kill themselves. A suicidal person who begins to show generosity is showing signs of recovery. And that's not really true, because some people who are generous might actually be thinking of trying it again. A lot of people, I've seen that, I've heard that a lot of people who want to commit suicide give away all their possessions. So looking at the generosity has nothing really to do with it. Some more myths are that suicide is always an impulsive act. Well, that's not true. We know that's not. It's usually thought, planned out. People people have planned this. They think about it a lot, so it's not impulsive. And another myth is that suicide strikes only the rich. Now, we all know that to be true because most of my friends are not rich, and a few of them have attempted suicide, sorry to say. Suicide happens without warning. That's a myth. Most people, as I said, think about it and plan out what they're going to do, how they're going to try it. It's not, it's a myth. Suicide is painless. That's a myth too. Let's see. Few professionals kill themselves. A lot of professionals, if they feel like, there's no way out, maybe they'll try it themselves. I got down here that Christmas season is lethal. Well, Christmas season can be the time when a lot of people get depressed because it's the holidays. The holidays are always a depressing time, right? Well, it's a myth that Christmas season is lethal. It's just it's no worse than any other time. Women don't use guns to kill themselves because of fear of disfigurement. Well, that's a myth. I knew a girl who shot herself in the head. Let's see. More suicides occur during a full moon. That's a myth. Suicidal people rarely seek medical attention. Well, that's a myth. Some people, it's generalizations. Generalizations are always bad in any arena. Most elderly people who commit suicide are terminally ill. Well, that's not true. Many believe that they are a burden to their family members and just want to no longer be a burden. That's why a lot of older people might commit suicide. And kind of related to that is a myth is that suicide is only limited to the young. Well, that's not true. It can happen at any age. Suicidal thoughts are relatively rare. I wish that were the case, but unfortunately, we all know it's not. We all know somebody or some person who's tried this, and it happens. Fortunately, though, most homicidal or suicidal people provide clues of what they're going to do and or cries for help. Let me see. The book lists 4 different clues, 4 different types of clues. There, the really easy ones to spot are the verbal ones. The verbal ones are indirect or direct, spoken or written clues. That's pretty easy to find. Some of the behavioral ones are purchasing a gun or a gravesite or slashing your wrist, taking a practice run. Those are some of the behavioral ones. Some situational clues are concern. People, they're having a rough time, so they might, they're having a difficult situation. That is a situational clue. If they're having a really tough time, you may need to watch them a little more closely and pay attention. If you're working with clients and they're having a tough time, then you might want to, listen for clues or watch for clues. some syndromatic, or just all different types of clues. They're leaving, verbal clues, and they're also purchasing a gravesite and a gun and slashing their wrist. So syndromatics are just a constellation of suicidal symptoms. Now there are a lot of different assessment um, devices that you can use to see if people might be suicidal or who have suicidal tendencies. The reason there are so many of these is because it's such an important thing. I mean, suicide is huge. Some of the assessments are the MMPI, you might have heard it or worked with it, the hopelessness scale, the Beck Depression Inventory, the Psychological Pain Assessment Scale, the Painful and Provocative Event Scale, the Acquired Capability for Suicide Scale, and there are a couple of assessments that are just acronyms, the SAD persons and the basics. I've never personally used any of those because, assessments may be great. They may indicate people have a lot of suicidal ideation or behaviors, but, you know, professionals should not be afraid to ask the question. Oh, the phone's ringing here. They should not be able to ask the question. And that's basically, are you thinking about killing yourself? And it should be asked as a closed end question, yes or no, and ask it directly, and don't beat around the bush and say, well, some of the stuff you're doing kind of makes me think that you might be. No, don't ask. Ask directly, are you thinking about it or not? And that's the case. The American Association of Suicidology came up with a mnemonic device for people who have some warning signs for committing suicide. That's is path warm. That helps you remember the things you need to look for. Do they have suicide ideation? Are they increasing their substance abuse or use? Do they feel like they have no purpose? Are they purposeless? Are they anxious or agitated? Do they feel like they're trapped? Do they feel hopeless? Is there nothing, no hope? Are they withdrawn? Are they angry or are they reckless? Do they drive recklessly? That might be a sign that they just don't care anymore. They drive really crazy like. And do they have significant mood fluctuations? That might be another sign that something's up. So the goal of anybody who's helping prevent suicide is to change one of the three I's. Individuals with suicidal tendencies, they feel like their problems are, inescapable. There's no way out. There's nothing they can do to avoid their problems. They're intolerable. They feel like their problems cannot be endured. And their problems are interminable. They feel like their problems go on forever. They're endless. They just have no hope. So if you're helping someone who with a suicidal thought, just change one of those three I's. That's the recommendation that the book gives, and that's the same one that I get too. Change one of the three I's. So, who are the victims? Well, of course, the real victims are the ones left behind, the family and other loved ones that have to deal with the fact that someone they know killed themselves, or someone in their family killed themselves. That that I mean, you're hurting someone. And as a counselor or a helping professional, you have about a 1 in 4 chance that one of your clients will commit suicide. It's not rare. It happens all the time, unfortunately. So anyway, I hope that I'm not going to have you ask me questions because you cannot, but I hope this brief overview provided you with some helpful knowledge. And, read up Chapter 8. It's really a resource. But I thank you.